Hello doctors, have a beautiful day. This is Dr. Hub, a passionate doctor mentoring worldwide. Autosomal dominant. So this includes the mnemonic that is heavily dominant. So heavy dominant is one mnemonic to remember, but as we discuss more disease, it will become very spontaneous for us to recognize what disorder it is or what inheritance pattern it is. So in case of H, H is for the hereditary spherocytosis. Next it is for the hypercholesterolemia. Next is the hypertrophic obstructive cardiomyopathy. And then there is also the Huntington's disease. Next we look at E. E is for the Ehlers-Danlos syndrome. Ehlers-Danlos syndrome. Then comes A. A is for the achondroplasia. Achondroplasia. Then we look at V. Heavy, right? So next comes V. So in case of V, what we see is there is the von Willebrand disease as well as the von Hippel-Lindau disease. Then comes the D, so dominant. So D stands for the dystrophic myotonica. Then O stands for the osteogenesis imperfecta as well as the otosclerosis. This is variable. Next M. M stands for the Marfan's syndrome. Marfan's syndrome as well as multiple endocrine neoplasias. Next comes I. I is for the intermittent porphyria. N. N is for the neurofibromatosis. And this is nothing but 1 and 2. So after this comes neurofibromatosis is over. So then comes the A. A stands for the autosomal dominant polycystic kidney disease, and N stands for the Noonan's syndrome, and T is for the tuberous sclerosis. And there are some miscellaneous. Miscellaneous stands for the familial adenomatous polyposis, next the hereditary hemorrhagic telangiectasia, and there is also the Li-Fraumeni syndrome and the pseudo hypoparathyroidism. So just to recap, we saw the autosomal dominant. So autosomal dominant, the mnemonic being the heavy dominant. So firstly we saw the H is nothing but hereditary spherocytosis. Then you have the hypercholesterolemia, hypertrophic obstructive cardiomyopathy, and the Huntington's disease. Next we saw E is for the Ehlers-Danlos syndrome, then A is for the achondroplasia, then V is for von Willebrand's disease and von Hippel-Lindau's disease. Then comes D is for dystrophic myotonica. Then comes O is for the osteogenic imperfecta and otosclerosis. M is for Marfan's disease and multiple endocrine neoplasia. I is for the intermittent porphyria. N is for the neurofibromatosis 1 and 2. And then comes A is for the autosomal dominant polycystic kidney disease, N is for the Noonan syndrome, T is for tuberous sclerosis, and next we saw the miscellaneous diseases, and this includes nothing but the familial adenomatous polyposis, hereditary hemorrhagic telangiectasia, and Li-Fraumeni syndrome, as well as the pseudo hypoparathyroidism.